Biden administration says it's procured enough Pfizer and BioNTech vaccine to inoculate all 28 million 5 to 11-year-olds in the U.S. and will distribute it in smaller doses with smaller needles, making it easier for pediatricians and pharmacists to administer it.
We know millions of parents have been waiting for COVID-19 vaccine for kids in this age group. And should the FDA and CDC authorize the vaccine, we will be ready to get shots in arms.
Both agency vaccine advisory panels are holding key meetings within the next few weeks to review Pfizer's data on kids, with a decision by agency leaders expected shortly thereafter. It comes as many parents are anxious to get their children vaccinated, as kids have already started the new school year, with the Delta variant spreading across the country. One of those parents, Surgeon General Vivek Murthy.
I will say that as a parent of a 5-year-old, I'm anxiously awaiting their decision. I also know that many other parents across the country are as well. Now, we also know that not all parents have access to a pediatrician or a family doctor to whom they can ask their questions.
Murthy says the administration is preparing a national public education campaign to inform parents about the vaccines, working with schools, also convening with doctors and health clinics to support them in delivering the vaccinations. On Tuesday, New York Governor Kathy Hochul said the Empire State is ready.
We are getting ready for this. But I want the schools to know that we are here to help. We're already in conversation with the school superintendents, letting them know we want this offered in schools, or at least in the immediate vicinity of schools.
Over the past week, according to the American Academy of Pediatrics, there were about 131,000 new child COVID cases and 1.1 million child cases over the past 6 weeks. Dr. Matt Harris is in charge of vaccine distribution at Cohen Children's Medical Center in Queens, and he's thrilled that the vaccines will be modified for younger children.
Both as a pediatrician and as a parent of school-age children who, hopefully will be eligible for the vaccine in the upcoming weeks, I'm extraordinarily excited. I think this is the next big step in the fight against the pandemic and a movement towards normalcy.
Now, the Food and Drug Administration is set to meet October 26th to hear data about the vaccine's safety and efficacy. If the FDA gives the green light, a vaccine advisory panel for the CDC is scheduled to meet November 2nd and 3rd to weigh a recommendation on use.